All right. We now have our zoll monitors in ICU now, so I figured that we should do a quick video on just some of the basics of the zoll monitors in the event of an emergency. First off, the defibrillator pads look like this. On the back of them, you'll see the connector that's wrapped in bubble wrap. So the first thing you do is take that out like that. You would open the pads like this. I have a pack that's already open, I'll show you that. But one thing to know is that once you open this, you kind of have to give a tug on the cords because there's a little piece that's actually connected in here. And you kind of like take this out, pull the pads, and then the cables will be free for you to use. So they open like this. And you notice that there's two pads. They're labeled 1 and 2. Zoll recommends that you use the anterior-posterior approach to defibrillation, so we'll show on the mannequin how you would apply the pads. The 1 would go on first, that you would put the posterior pad on, and then the 2 would go on second. This is the anterior pad. This thing here is actually a feedback device that will go to the zoll and will tell you how your compressions are going. It will actually say good compressions if you have good depth and good rate. It will tell you to speed up, slow down, press harder, don't press so hard if your compressions aren't adequate. So it's a good feedback device. This is, an evidence-based thing that we're moving to. So, to demonstrate on the mannequin, we'll show the anterior-posterior position. So you would bare your patient's chest. So the first thing you would do is you would turn your patient. You peel the first one off, just like this, and you would put it on posterior. Basically think, okay, the heart's right here. You want to go behind the heart. I'm just going to stick it there for now. We'll roll the patient back. And now we'll apply the second pad. Peel this one off. So it even shows you here, the feedback device, the crosshairs go mid-nipple line, just like that. In the event that you can't turn your patient, you can apply the pads anteriorly and laterally. All you would need to do is take the anterior pad, flip it upside down, and place it on the anterior position on the right anterior chest. You would take the posterior pad and place it laterally. So then, you would connect your pads just like this, and they do click. So to disconnect, you would have to press this button and pull pretty hard. So they're not going to disconnect easily. Just put them together, click, and they're connected. So going to the monitor. There's no on button with this one. Like we had the life pack, there was an on button. With this one, what you're going to do is select the function that you need. If this was a patient that needed to be defibrillated, you move it over to defib.
Check pads.
Now just ignore what the monitor is saying because I don't have it in test mode or anything like that. But just to show how you would defibrillate, you go to select energy. And on this one, the max that you can go to is 200 joules. There's no 300, 360, the max is 200. And the manufacturers from Zoll tell us that their 200 joules is the equivalent of 360 on the life pack. So you can select your energy. So you can charge it. You just hit the charge button. And the red light comes on. And you would hit shock. I'm not going to do that right now, but that's how you would defibrillate your patient. So let's say that you had to do a synchronized cardioversion. If the provider wants to do a synchronized cardioversion at 120 joules, let's say it's AFib, you go to 120 joules, and what you would have to press is sync on off. Now there's no complex right here, so it's not going to show you the sync marks on the QRS, but you would just hit the sync on off, and that's how you would synchronize your monitor. And then you would do the same. You would hit charge and then shock. If you have to run this in pacer function, you move this down to where it says pacer. Now the really nice thing about the pads that we have is that they can both sense the patient's rhythm and pace. So you don't need to put the ECG leads on the patient to do pacing. These pads are it. That's all you have to put on the patient to do pacing. So you can, you know, if the provider gives you a rate that he wants the patient set at, you can adjust the rate. It defaults to 70 beats per minute. The rate knob is right here. So you can go up, you know, let's say we want a rate of 80, and then you would just go up on the MA, just like this, output MA.
Check pass.
And it's going to alarm at me because there's no rhythm detected. But that's how you would do that. I'm just going to turn it off for a second. There is a function with the pacemaker where it says 4-to-1 right here. If you want to know your patient's underlying rhythm, what this will do is when you press the 4-to-1 button, it will inhibit 4 beats and pace 1. So you won't completely lose capture, but you can see what the patient's underlying rhythm is. It does still have the analyze function. You can just switch it to defib, and you can hit analyze. And that would just run in AED mode. And it would say shock advised, no shock advised. So. If you had to do hands-on defibrillation for some reason, I'm just going to leave the pads on there, but you would take these off. Your hands-on paddles are on the side. They are not wireless. What you have to do is on the side here, you have to connect the cable just like this, and it clicks it, and it makes a beep there. And you can select the energy, you can charge them, you can shock, you can do everything right from the paddles, just the way that you would with the old ones. To release it, just slide this button and pull.
Check pass.